Welcome back to the Elle-Sera podcast. And today I'm joined by Dr. Sahil. No preamble today. He is a cosmetic dentist and he's extremely good at what he does. So let's dive right in. Sahil, thanks for being with me today.
Thanks very much for having me. Glad to be here.
As I said, there's some podcasts I look forward to. I look forward to them all. And there's some that I really look forward to. And today's I'm really looking forward to. So I was in the hairdressers like I am before every podcast. And I was asking the room, of which was about 5 women in there getting their hair done, like questions, myth busting. What would you ask a dentist? So I never print questions out for my guests. I definitely don't use them, but I'm going to use them today.
You've had far too many questions.
Because there is so many. Yeah. And then I went on Amazon and I started looking at products, for your teeth. And I was like, is that any good? Is that any good? Is that any good? So there was loads of things I was like prompted. So let's start. This is the biggest one I see in the industry and something that I have debates about with my friends all the time. Fluoride versus non-fluoride toothpaste. I know people who will live and die by non-fluoride, will die on that hill tomorrow.
Me too.
Yeah. And then I know dentists who are like, you need to be using fluoride toothpaste.
I'm really glad you brought that one up first because it's kind of going straight to the center of it.
Yeah.
Non-fluoride toothpastes are on the rise and they're getting more and more into public domains. And I was debating this with a dentist even last week. There's a conference in Las Vegas that happened a couple of weeks ago, the American Academy of Toxicology and Oral Medicine. Yeah. They were discussing using non-fluoride and also phasing out silver fillings and things like that.
Yeah.
And they made a recommendation to get rid of fluoride.
Right. That's a big conference. Is that from a toxicity point of view?
It's from a toxicity point of view to the individual.
Okay.
And environmentally from the production and then everything we spit out into the water supply.
Yeah.
Now, this academy is different to the dental world. Mm-hmm. It's not to do with research-based outcomes for health reasons. I went back through all the research that's been done on fluoride after this post was put out, and I kind of reminded myself, what are the reasons why we have fluoride in? 3 main benefits. Fluoride inhibits one of the pathways for bacteria to cause tooth decay, number 1. So it prevents that from occurring. Number 2, it hardens the tooth against dissolution from acid, and that's what causes tooth decay as well. Mm-hmm. So it makes the tooth shell harder. That's the enamel, right? And the final one is it stops it getting softer in the first place. So it actually helps the buffering capacity in the mouth stay neutral. Having the saliva in our mouth helps that. Fluoride takes us up to a higher level.
Right. 3
established benefits. And these aren't up for debate. These are pretty much facts. That's been proven histologically.
Who's funded the studies on these facts?
Okay. I won't point to one particular study because one particular study is not going to tell us what to do. We need a wide spectrum of stuff to then be amalgamated and then to show us a common conclusion, if there is one. Mm-hmm. Fluoride is one of the few things that has enough data to say we have a common solution. I'd recommend going through things like Cochrane reviews, which is just a process whereby people take data from different studies, pull it together, try and reconcile the differences between funding, bias, population size, sample size, all these things that can make studies less relevant and important. And it comes to a conclusion based on sensible conclusions. There are several Cochrane reviews for fluoride, and the author is Marino. It's a research scholar in dentistry, and they found the established benefits of fluoride on the mouth are a reduction in prevalence of tooth decay by up to 24%. Personally, I'd say 24% is conservative, but that's the data they put out based on many studies. Each study, you can delve into the different issues if you wish. So I'd look at systematic reviews and meta-analyses, which is a Cochrane review is one of the major versions of that. And coming back to your original question, fluoride versus non-fluoride. There is a reasonable argument to say fluoride at a high enough dose can cause issues. Mm-hmm. Fluoride in our toothpaste is about 1,500 parts per million. It's pretty low.
Okay.
And the majority of that, 99%, gets spat out into the sink. So it's what we call topical, meaning we're not taking it as a tablet. It's not entering our bloodstream. The tissues in the mouth may absorb some of it, but it's very, very low. So how much of that goes into our bloodstream is trace.
Yeah.
All of the proponents of non-fluoride are assuming that the fluoride we take in our toothpaste is ingested and it's entering the bloodstream, and that's when you can potentially have issues that are reported. We're not seeing that. And we're not noticing that over the many decades fluorides have been in the supply. There are also examples where it's naturally occurring in the water system, such as Birmingham.
Yeah, so this was my other question. If it's, because I had a look at this before this podcast and I was like, this is a natural mineral, but the devil is in the dosage. Yes. Like with anything, the devil, the dosage is the poison. If you have too much of something, of course, it can have a really adverse effect, but sometimes a lot of the things is so low dose that you're probably not going to, it won't do anything to you. So it's naturally, and then I actually checked my water supply because then I heard from my non-fluoride, diehards, they're putting it in the water. You shouldn't drink tap water. Agreed, there might be lots of argument of why not to drink tap water, but who's putting it in the water? I'm like, who are these people who are putting it in the water? Definitely didn't have any where I live in Ormskirk. Very, very low. I got these, I don't know if my test and my experiment was any good, but I just got these things off the internet to test the fluoride and it was very, very low. So in Birmingham, it's high.
Naturally high.
Right.
And we're not noticing any issues in terms of their physical health. The point you raised earlier to do with therapeutic dose, toxicity dose. So it starts off having, if any drug will have a certain level of input in the body has no effect, negative or positive. Mm-hmm. Then there comes a therapeutic dose where it's giving its intended effect. And then if you go higher than that, you're into toxicity.
Yeah.
The therapeutic dose of fluoride is 1,000 parts per million in toothpaste. So that's used topically, meaning it's not entering the bloodstream. It's spat out. It's used just on the surface. If you're swallowing it through drinking water, the therapeutic dose is about 1 part per million, which is pretty low. Mm-hmm. A few American dentists have tried to encourage their state to fluoridate the water supply. They've always lost, generally, because mass medication is something we can debate all day long. It's doing something against someone's free will to a degree. I guess so they have the option of buying a bottle of water, which many do for different reasons. But if it improves health outcomes and there's no medical ill effect or side effect, which seems like there are not so far, I'm generally in favor of it.
Okay.
I don't think it will ever pass through just because of the lack of sentiment towards mass medication in this country and America. So circling back to the original question, non-fluoride versus fluoride. I'm willing to be proven wrong in time to come because the data is really kind of racking up as years go by. Currently, the evidence base supporting fluoride in use of in toothpaste for adolescents and women and children is still pretty strong. I don't see the potential negatives of the environment and the medical health of the individual being strong enough to outweigh the benefits. Not yet, anyway.
Okay.
I need to see some more compelling research, and I don't think we're going to get it, to be honest. On a moral level, I think someone can decline to use it.
Yeah.
But I think they have to accept that there are some established benefits of using fluoride.
I buy toothpaste for my little girl. She's 18 months old and she loves brushing her teeth. Like, will shout for her toothbrush, loves it. Like, she would do it 10 times a day. Yeah. She loves it. And I think that's because it's like the strawberry flavoured toothpaste, let's be honest. Yeah. She's got 2 types. She's got one called Jack and Jill, which is non-fluoride.
Yeah, I've heard that, yeah.
And she's got a little Colgate big teeth one or something.
Okay, nice.
Yeah, little teeth one and it's got fluoride in it. So I just switch it up, really, to be honest.
So you're on the fence, is that?
I'm a bit on the fence. Yeah. This is my first question today because I'm a bit like, well, which one do you want today? Do you know what I mean?
What does she like?
She doesn't care. She just loves brushing her teeth. Yeah. She just loves it.
They've made it really fun with the flavors and the characters they've brought in. I wish they continue that to like a bit older
adulthood.
Age.
Yeah. Okay, so that's kind of conclusive, but also not. So, until we see more data, you're open-minded. But until then, you're happy for everybody to use toothpaste, your patients, everybody.
Absolutely. I think I need to see some pretty compelling research to change my view. We're asking something pretty big here. We're saying that we're going to undo all of the fundamental teaching of all dental schools across the world,
Yeah.
it's a pretty big ask. And many would not be open-minded. They would say, no, you need to stop
you're
talking
wrong.
to me.
Yeah.
I think I'm willing to read stuff,
Yeah.
but it's got to undo some pretty strong data, systematic reviews, meta-analyses, randomized control trials, the highest level of research available, reconciling all the concerns you've got in your mind. Fluoride is one of those areas where people have got that data and we're trying to undo it. Okay, I'll listen. But for now, I'd recommend to continue.
Okay. So me from a personal level, what brand of toothpaste should I be using?
I get asked that all the time.
Which do you like? I can tell you my preferences.
Yeah, sure. Let's hear it.
And then tell me, what's complete marketing rubbish as well. So I like Marvis, but it's expensive.
Okay. It is. It tastes good though.
Tastes great.
It's
and
great.
It looks great.
Good branding.
Yeah, great branding.
Great branding,
Like,
good
great
tube.
British brand
Yeah.
of toothpaste. Love it.
I'm all for supporting British businesses.
Yeah,
so I think
same.
made and designed in Britain, I'd go for it.
Yeah, I like it. But it's expensive. It's £11 a tube.
It is expensive. So you could ask yourself, if you were a family of 4 people and you're buying toothpaste for the entire family, would you splash out on the £11 tube or the £2 Colgate total?
Well, then I've got a lot of that too. So I've got I've got Pale Drops.
Okay. You're trialing all of them.
I've got you should
could be a dentist.
see my cupboard. Yeah, you should see them. So Pale Drops, where do we stand on that? Good or bad?
Pearl Drops, as far as I understand, it has fluoride, right?
Yeah. All of these have got fluoride. Yeah.
I have not got any issue with ones that have fluoride in them. I think it's okay.
So is all toothpaste the same pretty much? I mean, because I've got one that's like Colgate with like little crystals in that's purple, like a purpley gel, but then foams up and goes white. Tastes great, whatever. Then I've just got your regular Colgate Total. Then I've got my Marvis. Then I've got my Hollywood Beverly Hills. And I've got Pale Drops. I've also tried charcoal.
Yeah? How'd that go? Apart from getting just black teeth.
Yeah, didn't really. I just thought it was marketing rubbish. And then the other one that I got sold is High Smile.
Oh, yeah.
So bought that, the purple foamy one.
Color corrector.
Yeah, so what do you think about that? I didn't really notice the difference.
Well, it's got something in common with the charcoal toothpaste, which is it's a contrast medium.
Yeah.
Something that's the exact opposite of tooth color. Paint it on your teeth. Teeth look really dark for a moment. You wash it all off. Your eyes look at the contrast effect more so than the actual effect.
Yeah.
So it looks like your teeth are whiter, but in fact they're the same.
Yeah. I know, but when they put these before and afters on the, Instagram to sell me this product, they put in like, teeth that look like banana skins, and then they put in, teeth that are super white.
High Smile have some clever marketing.
Yeah, it's great marketing.
Very smart marketing. As do Colgate and all the other brands you mentioned. It's sort of a bit of a war on the dental product shelves as to who can claim the best benefits and say that they're supported by dentists and appeal to what the individual is looking for, which is probably smart branding and something that tastes good and is maybe reasonably priced. Okay,
so I would imagine it's different in the States because I bought a lot of dental products in the States as well.
Yeah. One
in particular is a mouthwash, and I buy it time and time again because it really does make my teeth whiter. You'd never get away with selling this in UK or Europe.
What is it?
It's a Crest one.
Okay.
And it really does bleach my teeth.
It's got peroxide in it.
Yeah.
Yeah. There is one called Peroxyl, which used to be available in the UK at a higher concentration since it's gone out of legality because of the change in regulation. So I think your Crest one is something along those lines.
Yes, it definitely does do something. But yeah, I have to, whoever's going over to America, I'm like, can you go get me some mouthwash, please? And they'll bring back like four lots of it.
Nice. Good idea.
So
coming back to your question, toothpaste, I'll try and organize it so that we can all make sense of all the different stuff that's out there. Categories of toothpaste. Whitening toothpaste. In that, you've got your smoker's toothpaste. The one that says is whitening is a category.
Yeah.
The difference in that is they've got more abrasivity within the formulation.
Okay.
So it's trying to whiten the teeth by stripping off a very thin layer, exposing a whiter
almost like an
enamel
exfoliator
underneath.
For your skin. It's like exfoliating the front of the tooth.
That's right.
Right.
A key difference between skin and teeth is that skin does regenerate, so it needs exfoliation. Yeah. Teeth do not. So it's not particularly...
You don't want to wear the enamel down.
No. So whitening toothpaste is a bit like using lemon juice. That's something that's online a lot now. It's going to strip off a layer. It's not particularly sustainable. So I'd use that with caution. The next one along is your standard fluoridated toothpaste. Anything with fluoride is beneficial as long as it's at the therapeutic dose. If you recall, therapeutic dose is
something that like gets it to the level we want it to, but not going past the toxicity.
Yeah. And for teeth, it's 1,000 parts per million. For adults, that is. And typically, all toothpaste hold between 1,000 parts per million and 1,500. If you're in that range, it's going to be beneficial.
How would we know? Does it say it on the back of the packet?
Yeah, it'll say it on the back. Ingredients, one of the first 2 or 3 ingredients will be sodium fluoride or something along those lines. And it will say a ppm number. And it's usually 1450 or 1350.
Okay.
That's the second category. The third one along is the so-called eco charcoal toothpaste. These typically don't have fluoride in, although some of them do these days. These ones, I would submit, are not so beneficial because there's nothing in them that's an active ingredient that's going to help the teeth or the gums, despite all the heavy marketing. The companies that design toothpaste are not under the regulation that dentists are under. When they make a claim, they don't have to substantiate it with any evidence.
Really? Not
Yes.
like, I don't know.
They could do an internal study within their company and say 99.9% of our respondents said it was beneficial.
Well, that's a bit like the beauty industry as well.
Same thing.
You know, you could just do 100 people, 73 of them said this was amazing after using it for 6 weeks.
Same thing.
Okay.
When I give advice, it's slightly different. Mine will be based on an evidence base in most cases. When it's not, I'll tell you if it's not available. So you've got the first 3 we've got there. The final one is sensitive toothpaste. These do have a different formulation, and there are generally 3 or 4 variants of chemicals they've designed and researched to help with sensitive teeth. If you're one of those people, I'd go with one of those. And there are 3 major ones. Colgate Sensitive plus variants, Sensodyne, and a newer one, Sensodyne Repair and Protect, which has since changed in its branding. All of those 3 are beneficial and they're pretty good. If you've got sensitive teeth, they still contain fluoride. So they have all the benefits of toothpaste number 2 with the added benefit of sensitivity. So which one to use out of these 4 categories? Either the sensitive one or the regular fluoride one. The regular fluoride one could be a Colgate Total, your McLean's, your Oral-B, all the ones you listed just now. Because they've got fluoride in, they'll be beneficial.
Okay, so stay away from the whitening ones, which are actually making my teeth more abrasive, which is making it porous. We don't want that.
That's right.
Okay.
And if it is an eco one, just check the packet, see if it's got fluoride in. If it doesn't, I'd rather you brush without any toothpaste.
Wow.
Just save yourself all the cost and hassle.
Okay. Wow. Okay. Brilliant. Well, it comes to my next question, mouthwash. So, raging debate I see online about mouthwash. A lot of the biohackers, they say don't ever use mouthwash. It's getting rid of the good bacteria out of your mouth. And then you've got stuff like Corsadol, which is like specifically for like gum treatment. And then you've got your regular Listerine or whatever. Now, I personally don't use anything. I only use my whitening mouthwash. Well, if it wasn't that, I would never use a mouthwash. You
really know your mouthwashes. You know more than most.
So talk to me about, mouthwash, would you recommend or not?
Your initial point was a biohacker said that it's removing the good bacteria with the bad.
Yeah.
A bit like an antibiotic would if you took one of those. We've got to ask ourselves, firstly, with our toothbrushing routine and our mouthwashing routine, what are we trying to achieve? Are we trying to disinfect or sterilize the mouth? No. It's not possible.
Yeah.
Just like the skin, the mouth will recolonate with bacteria within about 30 seconds of you stopping your brushing cycle.
Yeah.
So if you use, let's say, one of those disinfectant mouthwashes, it's not beneficial to remove all the bacteria. It's not what we're trying to do.
Yeah.
We're trying to reduce the amount of debris that's stuck between the gum and the tooth.
Yeah.
That's about it. If we have the added benefit of increasing the hardness with something like fluoride or a sensitive tooth agent, great.
Okay.
But we're just trying to remove plaque and debris from all aspects of the tooth. Kind of not really to do with bacteria.
Yeah.
There is an effect, but it's not to do with disinfection.
Okay.
So let's remove that from our minds. There are lots of mouthwashes on the market. The variation in fluoride is quite significant. They're all quite low. They're about 200 parts per million, which you'll remember is quite a lot lower than our toothpaste. Yeah. So it's a lot weaker. Our therapeutic dose is 1,000.
Okay.
So if it's at 250, it's in that kind of...
It's not even doing anything to harden the teeth and protect them anyway.
That's right. So what's the purpose? one of the things that they've done is they've put more acid content into mouthwashes, especially Listerine and Dentyl Active, to make the pH relatively low. So it softens the surface of the tooth and then allows the fluoride to act more aggressively onto the tooth. This is something that Swiss and German dentists abide by, and they think it's a beneficial thing to have mouthwash used. My feeling is we have so much acid in our diets day to day. It's only increasing. Sensitivity is on the rise. If we can take a chance to reduce the amount of acid by not using mouthwash, I think it's a good thing. Now, I should say that's not based on any evidence other than my anecdotal experiences of seeing many patients go through their lives. Which mouthwash to use? Something like a Sensodyne or a Colgate Plax is pretty good.
Okay.
They're not very acidic. The ones that I would stay clear from are the Dentyl Active and Listerines.
Right.
Listerine is dominating the market.
Yeah,
it's just
and I think
everything's Listerine.
I think it's the mouth feel that people like. It feels
burns,
clean, you know, and that's actually what's the trigger. It's like my mouth feels great. You go to work, your breath smells nice. You know, for the next couple of minutes that you. The
benefits are fresh breath in the middle of the day. Let's say you're not brushing your teeth at noon time. Having a mouthwash rinse is actually a good idea because you haven't brushed your teeth. But doing it after brushing or morning and evening is not that helpful. It can also undo some of the good work you've done with brushing because you've taken your concentration of fluoride from your toothbrushing routine from 1450 down to 200 by rinsing with mouthwash.
Yeah.
So you've just diluted everything.
Right.
Not helpful.
Okay.
So I'm not saying not to use it. I'd use it sparingly.
Yeah.
You mentioned a couple of variants which are slightly different formulations, such as the peroxide-based ones. Yeah. We can't really get it much in a high concentration in the UK. Peroxyl being the major brand, but it's at a much lower concentration than
the American
Crest.
Ones. Yeah.
Because of legality reasons. That one can be beneficial. Actually, I'd suggest continuing with it.
Yeah.
And the next one along is Corsadil.
Yeah.
Corsadil is a brand name of a mouthwash that has fluoride, but it's got an antiseptic in it called chlorhexidine. And it's very well known to help with gum issues. That being said, it's only helpful for people who have gum disease. Okay. It doesn't really help with gingivitis, which is what affects most people.
Okay.
The other thing is Corsadil causes more staining on the teeth.
Right.
Because of the antiseptic. So if you use it every day, we've noticed some patients come back and they've got staining. So you might exchange one problem with another. So I try to simplify things and think about your brushing routine as being cleaning between the teeth, brushing the teeth, and kind of discontinue using mouthwash unless it's in the middle of the day.
Okay. That's good. Nice little freshener. Yeah, that would be great. Okay. So getting debris away from the tooth was what you said before. So I was having a look on Amazon. What do you think of the water flossers?
They're a good idea.
Better than regular flossing? So regular flossing with the string?
Well, we've got string and tape. String being, tape being just a bit wider, like a ribbon, tends to be better because it can twist, it can wrap around more debris more, and it can pull out more. String being a bit more flexible, fragile. But
I mean, I've got one of those ones that's like a little guitar string.
The harp, floss pick.
That's it. Put it in. Yeah. I just put it in once and out, and in and out. But I can't do that at the bottom because I've got a fixed retainer.
Yeah.
So I regularly have to go and get that
water flosser
cleaned out. Yeah, I've got a water flosser. Still in the box.
Still in the box. Okay. A water flosser is good. The evidence seems to tell us that it's useful in addition to, not replacement of, good interdental cleaning. Mm-hmm. Good interdental cleaning is referring to interdental brushes, not floss.
Well, I've got loads of them as well.
Which colours?
So just ones that will fit through.
Pink and orange, maybe.
Yeah, little. And I have bought red in the past. They're way too
quite
big.
Yeah,
way too big.
They go all the way up to grey, which is kind of like pipe cleaner size. Depending on the size of the gap, you'll have different sizes. They are actually the most beneficial thing for going between teeth, if you can fit them through. If you've got fixed retainers, no chance.
Yeah, I can't.
Floss is helpful if you can't get a interdental brush through. Because there's no bristle, we find that it doesn't mechanically clean the tooth as well as a interdental brush. And that's why we always recommend the TP brushes that you've got at home.
Yeah.
Water flossers don't brush the tooth either. It's just high pressure air and water firing through the tooth, removing any loose debris.
I feel like in terms of the environmental benefit, because those TP brushes must be clogging up the world, then the water flosser probably is going to be the best. overall?
I'd love to say yes. The problem is we need a bristle against the surface of the tooth and the gum to effectively clean it. Something called shearing force.
Right.
If you imagine a bristle is straight, as soon as it touches the surface, it starts to bend and flex.
Yeah.
And if you use them a lot, they become permanently deformed.
Yeah.
That shearing force is what removes debris and plaque.
And they're just water, no matter how pressured it was, it wouldn't do that the same.
It will remove a lot of it, but it won't remove the one that's stuck kind of most tightly onto the gum. That's what we're finding anyway. It's really handy for cleaning around certain types of dental appliances like bridges, implants, which are kind of quite complex in shape.
Right.
So we do actually advise it quite a lot for those patients. But for someone who's just got regular teeth, maybe a retainer, if you can, and you've got the dexterity to, I'd encourage you to use an interdental brush. Despite how demanding it is on your time and dexterity, the environmental piece I accept. I think dentistry is a problem for the environment because we're using a lot of single-use plastic in general. The plastics we use in dental when it comes to toothpaste tubes, toothbrushes, interdental brushes are a problem as well, but they're not single-use. You can use them again and again.
I mean, you can, but I like knacker mine because they like end up like that size because I'm like in and out, and out. But I mean, I did Bear Grylls The Island and I could have had a different toothbrush every single day if I'd have wanted because there was that many washed up, and that kind of plastic just doesn't disintegrate. And that means, so when I came back and I actually started Googling this because I made some for my customers, some bamboo ones. And the sustainability piece that I put with it was all about, do you understand that every single toothbrush that has been made since like almost time began is literally still on the planet somewhere today. Like that plastic does not degrade. So, and I'm a bit like, so this is also, it is an issue. Do we go to bamboo? Do we find a new material that we could be using? I mean, definitely the handles, you could probably use it at some stage. We could why not make it out of aluminium?
Yeah.
Or metal or brass. Or I should be doing it out of brass.
I think it's a reasonable comment to develop into something sustainable. And I think that there is work in the background from the major players to develop something in wood, in metal that is not as damaging.
Yeah.
Because I accept some of the medical and dental things we use to try and improve our health is not so great for the environment, and it's catching up with us quite quickly.
Well, it'd be like your dental tools. They're all made out of steel or
yes,
whatever.
They are, and they're reusable.
Yeah.
But actually, dental practice, we use a lot of single-use plastic because we're mandated to, such as personal protective equipment, such as visors, gloves, aprons.
Can they be recycled?
They cannot.
Right.
Even if they could, our regulators would not permit it because it needs to be clean and disinfected and sterilized for the next patient for cross-infection reasons. So there's almost no way out of it.
No.
Which is a problem. I can ask a difficult question here and say perhaps the reason why there isn't such pressure on medical and dental to change into eco variants is because human beings have always prioritized ourselves before the planet.
Yeah.
And now we've noticed that the planet's really suffering because of us. But if the balance is to not use a toothbrush or not have availability of a toothbrush in favor of not polluting the environment, we'll always choose to use the toothbrush.
I would 100% always use a toothbrush, but I'm thinking, why can't we make the handle out of brass or metal? Absolutely no reason why not. You're just holding that part. There's nothing in that. We'll get onto electric ones in a minute. But
there is one part, which is I take issue with bamboo.
Why?
Well, actually two parts. One being bamboo is quite porous.
Yeah.
So as time goes on, it gets a bit soggy.
Yeah.
It doesn't dry out fully. Hygiene issues. The second one is it's inflexible. Mm-hmm. Most toothbrushes, manual ones, are designed with some element of flexibility in the head and the neck. It stops you pushing too hard and causing gum recession, abrasion on the teeth. Bamboo toothbrushes don't flex. So if you're quite a strong person, you can really put some force on.
I've definitely done that on one side. My dentist always says, so you right-handed because you're literally sawing your gum away on that side.
So a flexible head toothbrush for you might be good.
Yeah.
But won't be in bamboo though.
No, I agree.
Or brass.
But I'm thinking, okay, so there's definitely an innovation piece to be done there, but I definitely think you could probably make something out of metal with some kind of spring. I don't know. And then you could make the bristles with like some kind of like rubber. Maybe. Silicone, maybe, because silicone's made from sand, essentially.
Have you ever seen the toothbrushes which have silicone parts within the brush? So it has
No.
bristles and it has silicone parts within it to improve the cleaning.
Okay.
So there is those,
yes, I have. Sorry, I've used them loads of times.
yeah,
Yeah.
so that's kind of one movement
Yeah.
forward, but I'm not sure it's using a sustainable material for
No.
that because they need to withstand certain number of flex cycles and things.
Yeah.
Usually synthetic materials
Will be better.
will meet that, yeah.
Absolutely. Okay, so manual brush versus electric toothbrush.
What do you use?
I use both.
Of course you do. You use
Of course
both
I
of
do.
everything.
I
You
use
the-
everything,
yeah.
you name it.
Manual toothbrushes are great. Electric toothbrushes, on the whole, will give you a better standard of clean.
Okay.
This is something that also has been under rigorous testing. We've got the highest level of research on it. We've got systematic reviews. We've got meta-analyses, pooling data from different studies. Typically, a manual toothbrush can be used to the same level of effectiveness. It's just physically harder because you have to use a certain technique called the modified Bass technique, which not many people are aware
Like
of.
a circular technique almost.
Small circular technique, yes, at a certain angle, and to angle it against each tooth individually. It can be hot.
You're just not going to do that.
It's quite
I'm
tough.
just not going to do that.
Well,
but-
knowing that dentists are taught this technique at university, we try it on ourselves and all of us end up being imperfect.
Yeah.
And we're dentists.
Exactly.
How can we expect the whole population to do the same? And the answer is they don't. So an electric toothbrush kind of gets you a bit further along without doing much work because you hold it against the tooth and the gum and it does its work.
My
you move
problem
along.
is I use my electric one like a manual. And I've been doing this for 10
Okay.
years and I have to physically, literally think about it. I have to actually catch myself doing it because I still do this every day. I brush it along, like a
Okay.
manual, but, instead of just holding it like that, I just don't,
Yeah.
So I'm probably doing worse damage.
Well, you're kind of hindering the electric toothbrush
Yeah.
from doing its work. It is quite tough to just let it sit and move it along. It's kind of almost robotic in the way
Yeah.
you do it. And that's what gives the most benefit.
Right, okay. Okay, so there's a new Challenger toothbrush on the market.
There always is.
There always is. No, this one's really turned some heads. It's really disrupted the market. It's called Suri. Have you seen it?
I have. I was sent one
Yeah,
months
I
ago.
bet you were, yeah.
Yeah.
I've heard them speak a few times from a business perspective. They're a D2C brand. They've disrupted the electric toothbrush market, which everybody thought was dominated completely by like Oral-B or whoever. What do you think of them?
Suri's toothbrush is a sonic toothbrush, meaning it doesn't have the same mechanism of action as a regular electric toothbrush that you and I probably know of, which is a small circular head that rotates and oscillates. So it has this motion.
So I've got
Right.
an Oral-B one. I don't know if it's sonic or not.
Yours will be an oscillating, rotating design.
Okay, it's rose gold. I know that.
I'm certain it is. It's got a small circular head, right?
Right, yeah.
And if you watch it tonight when
Yeah.
you debrush, it does this. And that's the motion that has the most powerful evidence base. Just that motion. Sonic toothbrushes have a regular head, but it just vibrates at sonic speed.
Okay.
So it's just vibrating against the tooth. We find that those are more beneficial, but not as beneficial as rotating, oscillating. The evidence base supports both toothbrushes.
right.
The anecdotal evidence base between myself, the gum specialist I work with, all the patients we see, we find people have better health outcomes generally from electric toothbrushes and specifically those that have rotating designs. It doesn't need to be Oral-B. It can be other brands.
Yeah,
We're-
absolutely.
We're not affiliated to the
No,
brand.
yeah.
It's more the mechanism of action because that's what's been put onto testing. So sad to say, the reason I didn't think much of Suri is because it's a copycat of Philips' design,
Right.
which is a sonic design that's been around
Yeah.
for years.
Yeah.
They've just packaged it better.
Yeah, they've done it in sleek pastel colours and put a really good marketing
Yeah.
campaign behind it
And
with
they've-
great influencers.
And a few influencers have got on the back of it, some being dentists.
Yeah.
And dentists may disagree with me and say, well, sonic toothbrushes are just as good as rotating ones. Anecdotally, I'm not seeing that.
Okay.
And my opinion is just one. It's supported by a few gum specialists I work with. And I think if you're using an electric in the first place, you're already miles ahead of a manual.
Okay.
But if you really just wanted gold standard for everyone, the rotating one is probably best.
Okay. I'm due a new toothbrush because I feel like
I think you've got enough at home, to be honest.
No, I have got a lot of tech at home. I'll give you that, but I just feel like the battery life and the power in it is gone. It's probably had about 4 years now.
Maybe it's
Yeah.
gone then, yeah.
It comes with like the app, And then which I've only used ever once.
Time your brush.
I am not interested in that. It beeps. Well, it doesn't beep, but it gives me an extra vibration when I should be moving on. But I'll be honest, I don't bother with that either. I do not brush my teeth for 2 minutes straight, going 30 seconds, 30 seconds, 30 seconds. I don't. I'll probably do it for...
Maybe the time is good for you then. It slows you down and tells you...
I haven't got time for that. And I've got my little girl going, give me more toothpaste on my brush.
Okay.
So, but I... I've spent so long like trying to get my lenses in, do this, do that, do the other. I probably spend a good, well over a minute doing it, but definitely not 2.
Okay.
I find that laborious and I just feel like it's not needed.
What makes you say that?
I don't know. I just feel like they're clean. I haven't got any stuff in there and, I don't really have any issues with my teeth. So I'm like, I think they're good enough.
Yeah, it's a good point you raise because people ask, where does the 2 minutes twice a day come from?
Yeah.
Is it based on this really powerful evidence base that I keep talking about? The answer is no, it's not.
What's it based on?
It's based on, as far as I was taught from my tutors at dental school, the prevalence of the pattern we're seeing of what people are doing and overshooting that because we know people won't do what we say.
Okay.
To maintain health on people who are not genetically susceptible to issues, we seem to only need to brush once every other day.
Right.
We don't tell that to patients because people may never brush again. They do once a week. So we say twice a day for 2 minutes in the hope that people might do once a day.
Okay. Yeah.
That's the mentality it's
I have a full regime before I go to bed. Do you know what I mean? It's like, wash my face, put all my cleansers on, it's just part of my routine. I'd never not do it really, unless I'm like horrendously drunk, which I've not been in years. So
a caveat on that, what I just said, I'm not suggesting people cut down their brushing.
Don't brush their teeth, yeah.
What I've just said is assuming that one has got a perfect brushing cycle, which we know people don't. No. It's very hard to. So I'd recommend going on the prevailing advice for now.
Apologies for interrupting this podcast, but I need to ask a favour. If you're enjoying this podcast so far, then please hit that subscribe button right now. I'll be straight up and honest that I want to see this podcast grow and flourish into something that I'm really proud of. And the only way that I can do that is with your help. So if you've ever learned anything useful from these conversations, then please return the favour by liking, rating, subscribing, and maybe even sharing it with your friends. Thanks very much. Let's get back to the episode. So, Sahil, when I was pregnant, my teeth moved. And I was like, oh my God, that's so weird because I'd heard that this could happen. But yeah, really noticed them move a lot and got really sensitive.
Yeah.
And again, a lot of our customers who are like menopausal, again, they say I met a lady in the hairdressers this morning who was my customer. She was like, oh, you're the golden girl. I was like, yeah, that's me. And she was like, yeah. And I said, I've got dentist on today on the podcast. And she's like, oh, my teeth have moved so much. Yeah. Why does this happen?
Throughout pregnancy, the body changes quite a lot. One of those changes is that the gums become much more susceptible to gingivitis.
Right.
So dentists coined a term called pregnancy gingivitis.
Right.
And it can progress to a mild form of gum disease for that period of time. And then after the baby's born, you kind of settle down back to your normal. But some effects could occur, such as the bone that's supporting the teeth becoming a bit softer.
Right.
If it's softer, the teeth are more tendency to move a bit.
Mm-hmm.
It's also a stressful period in your life. So it can end up with people using their teeth in an adverse way, grinding their teeth at night maybe, and all those things can contribute. That's the answer for pregnancy. For menopause, it's a bit more complicated because many more decades have passed since that age has come to. The bone porosity reduces, affecting the mouth as well as the rest of the skeleton. The other thing is our face does change shape as time goes on. So what we tend to find is the shape of the jaw is almost a horseshoe shape. It becomes narrower. And if it becomes narrower, there's less space for the teeth to be there. So the teeth then drift to compensate for that. What we notice is the teeth drift forwards and towards the midline.
Right.
So if you know elderly people that have crowding on their teeth, it's likely that that's got worse over a period of decades. Menopause accelerates that movement by reducing the porosity on the bone, making the teeth more likely to move.
Right. And what can we do to prevent that? Obviously, it's inevitable. So what's the answer? Is it just, retainers? Is it?
The skeletal changes I mentioned can't be reversed as far as I can see. There are certain things you can factor in to ask yourself if you're a high-risk person for it. So we tend to find it happens more in females than men for some reason.
Mm-hmm.
It also happens more in people with long or oval faces than people with squarer or shorter faces.
Basically me then. Right?
So take that into account. Yeah. And what to do about it.
Well, I've got a fixed retainer
Well,
on.
you've already done one of them, yeah. Fixed retainer, also a removable retainer to wear at nighttime.
Yeah.
Acting for several functions, keeping the teeth from drifting in case your fixed retainer breaks, protecting your teeth from any nighttime grinding you do.
Yeah.
And essentially it will ensure that your teeth don't age despite the movement in the jaw. They will move much slower. So that's probably the single best thing I can advise.
Okay.
There are lots of medications we can talk about and get into, probably a little bit outside my scope as to the dental side, because it's quite a complex interaction with the rest of the body.
Yeah.
But certainly the bone porosity goes down, and that's the biggest one.
Okay. Well, I can't believe we haven't mentioned this sooner, but I know lots of people that go off to Turkey and go and get their teeth done. And, and I look at them and let's say, okay, I mean, apart from them being obvious, which is what I take umbrage with, they're far too white. They look like tombstones. They're too flat. They're very matte. They're very like ramrod straight at the bottom. I mean, apart from all of those issues that, for aesthetically, like Jesus Christ, they don't even look like teeth. Tell me why or why not should we go to Turkey for our teeth, or any of the, these countries where it's very, very low cost dentistry?
As you've pointed out, the reason people are going is the cost saving. Mm-hmm. The second aspect is they do like the aesthetic that is being achieved. So it's a matter of perspective to a degree. When someone's teeth are already healthy and they're just looking to improve things, they're in control much more than we are as healthcare professionals to a degree, because they're trying to bring about an improvement. So they're taking on some level of risk financially and medically to bring about a solution. The concern I have is the methods used are quite aggressive on the teeth. So they're using crowns instead of veneers. So they're going quite aggressively on the teeth. You've seen the photos on TikTok and Instagram.
Well, this is my other issue, right? So I'm thinking, in my head, it makes absolutely no sense. And I don't know, I always think you've got to keep your teeth healthy for the rest of your life. These are my teeth.
Yeah.
I could live to 100 and I'm only going to have the same teeth. Whatever I do not get rid of their healthy tooth. And I see girls in their 20s getting their teeth filed down to like a stump to have then fake teeth put on. Like Katie Price, she shares a lot of her pictures. And I'm like, oh my God, surely in your head, you'd never, like, it's like getting rid of like your arm to stick on a false one or something. It's like ridiculous. It's like, why would you get rid of a healthy body part to then make something not act the way it should do in terms for aesthetic? I just think it's nuts.
I think you and I are in agreement. There's an argument of degree. How much risk are you willing to take to bring about a positive outcome? And you could look at extreme examples of Michael Jackson and his extensive surgeries. Yeah. He took a level of risk to bring about an aesthetic change, perhaps too far, depending on your perspective. The turkey teeth, similarly, the aggression on the teeth is such that you may lose those teeth in the next 10, 20 years, because if you cut them down that small, you can only ever work with that tooth ever again. Yeah. And there's not an infinite amount of times you can have crowns or veneers replaced before the tooth is more or less knackered and it breaks. Then you're looking into implants. And then
you've got so then what do you have to do? I've put a screw in there to try and...
That's right. Remove the tooth, the root, and then place an implant or a bridge. And these things are imperfect. A natural tooth is always better than a prosthetic tooth. Even though implants are super advanced now, we can make them pretty much natural. It's not easy to do.
No.
And it's highly expensive. So the complexity racks up quite a lot as soon as you cut things down from like you say, a healthy tooth down to nothing. Now, I'll temper that with, I'm a big supporter of cosmetic dentistry in that it can bring really good outcomes for people who are unhappy with the way they look. But it can be done conservatively in a way that doesn't require teeth to be cut down to little pegs.
I am in your camp of conservative. Like, I I'm very conservative with my teeth. Just, you can probably tell I've had mine bonded.
Composite bonding being one of them.
So, and I didn't even go, I think he's only done 5 teeth. Now, I didn't even get the whole mouth done. A lot of people I know will go and get their teeth bonded and they get top and bottom done. Yeah. Again, I think it's a bit too far. If you go to someone like yourself or somebody who's super skilled in being able to do the bonding really well and make it not look like it's
also a question of perspective as well, depending on where your teeth are, how healthy your teeth are. If your teeth are already in a good position, maybe you don't need to do all of them. Some people do want really bright teeth because that's the look they like. And I respect that. I understand that people are grown-ups, can make their own decision. And I'm not here to tell them what color I think is going to be best for them. I can give my advice.
Even though that's your work, walking around, right? And when people say, where did you get your teeth done? I went to see Dr. Sahil. I mean, I know other people in other industries. I've got a friend who's coming to mind. She does tattooing, facial tattooing.
Yes.
Now, you would never know. You would never know. You'd never really know that I've had my eyebrows tattooed because she does it with real lightness of touch, and that's a skill I'm paying for because I don't want people to know. You want to improve, but not go too far. She absolutely refuses when people say, I want this. And she goes, well, I'm not doing it. You know, go and take your money somewhere else because I'm not interested, because I will not let that walk out to my salon and have my name attached to it. So if people did want ridiculous white, you know, tombstone teeth, would there not be a point where you, well, then I'm not the dentist for you?
There does come a line at some point, yes. And it's case by case. I was speaking to my ceramist about this as well just recently. You can get happiness in both camps. The client would like really white teeth, whiter than you and I might want. But there are ways of making teeth really white and still look natural and have gradation of color that makes them not tombstoned or like a piano key or what we call mono, meaning they're not one color all the way through. Teeth are not designed like that, but you can still make them super bright.
Exactly.
So there are things that we can do, even when the client would like something really bright, to make it still have our stamp of quality assurance and having that degree of natural effects, which are possible even in the brightest shades. So I try and warm to the person in the chair as to what their perspective is. Ultimately, it is their decision, as long as they understand all the pros and cons of having really bright teeth for the rest of your life, and that things may change. And I give them my advice.
Yeah.
But they're welcome to reject it.
I always think it's good practice to put a few tiny kind of imperfections back in.
Yeah.
You know, I think he put a couple of imperfections back into mine to make them look more natural.
Natural, yeah.
You know?
Yeah. And that's one of the examples of what we could do with, let's say, 10 teeth on the top, which are super bright, way brighter than we would advise, but we've gone with that color. You can put small inflections of color of translucency on the edges of the teeth, variation on the edge, things that are not immediately visible, but when we take a close-up photo, we could stand by the case and say, yeah, that's certainly something that's been handmade, and it's not just made by a computer in one color.
Well, exactly. And that's kind of my issue when I see Klopp's teeth and I see Firmino's teeth, because they are like, and I can't believe like people still go to that dentist, you know, when these people are ridiculed, like literally on every football forum, people are ripping Firmino's teeth for being ridiculous in every way. But I mean, there is a market for that and people really like it.
There is. And Turkey Teeth just meets that demand, and in a very fast way. You arrive on the Monday for a consultation. Tuesday you have your teeth cut down. Wednesday you come in to see what shapes you like and choose a color. Thursday you have them fitted. Friday you have them checked, and you fly that evening.
That is absolutely nuts.
It's wild, and people love it. But coming back to the market for it, it's like Ryland's teeth. Ryland had huge teeth. You could argue
so bad.
He made his name from having these really white and big teeth, and he's since had them redone. Yeah. But people remember him for that. Yeah. The number of times people say, just make sure I don't look like Ryland.
Oh, exactly. They're absolutely awful. Okay, so my daughter is a fruitaholic.
Okay.
She loves fruit. I really, you know, she has like a punnet of blueberries almost every day.
A big one or a small one?
No, the little ones, yeah. But she'll have a few in the morning. She has a few grays. She grazes on them, mainly for the neurological benefits of blueberries. They come out very high. So I really advocate her having that.
Blackberries as well.
Absolutely. And raspberries. And she just loves fruit. So, but talk to me about the effect of that on the teeth.
The sugar in fruit is typically what we would call intrinsic sugar, meaning it's contained within the cells, within the kind of live fruit. And as a result, it still has the potential to cause tooth decay, but it's at a slower rate. So the chemical that's being broken down is fructose, whereas something in granulated sugar into coffee is sucrose or glucose, which is a simpler form of the same thing. Fructose just being kind of one chain up. So you've got to break fructose down into glucose first before it can start to become tooth decay. So I'm never going to tell anyone to stop eating fruit because of the health benefits probably outweigh the dental benefits, especially for a young person who is growing. All I would say is if it's happening as a snack many times throughout the day, encourage your daughter to isolate it within meal times where possible. It's tough to do.
It is.
It's such an easy snack.
There's not many snacks you can give her that are healthy. I mean, there's only so many, because what's the other option? It's usually ultra processed. Anything, any baby food has got gluten-free, only 96 calories, Pom Bears or something like that. And they're all ultra processed rubbish with terrible oils in. So I'm like, well, what's the next best alternative? Sorry, it's fruit. Carrot sticks with hummus she has, things like that as well. But,
which is why I'll never say to you to not go for it. Continue with it. There are some fruits which are less sugary. So, apple and pears being kind of towards the top and with raspberries and things. Bananas. They vary in their sugar content.
She loves bananas.
From green to yellow.
Yeah.
So if she's having a lot of bananas, stay towards the greener side.
Yeah, but they taste horrible.
Less sugar in them.
They do taste horrible, and they're so hard as well. So I just go for a nice yellow, not the brownie one and not the green one, just normal.
Yeah.
But I mean.
In that case, the health benefits supersede the dental.
I don't think she's going through it at a rate that's going to be anything to worry about. I wouldn't say so. But I refuse to let her have fruit juice or anything like that because I think that's a bit too concentrated. So she just sticks to water. The other thing she does have is a dummy. And I'm a bit like, oh God, but I haven't got the battle in me just yet. I've just taken a milk off her at night times. So she was having milk, just for a little bit of a comfort just before bed, and it gets her to sleep nicely for me.
Okay.
And I've just dropped that now. So she's because I'm going to start potty training her and I don't want her to be, having accidents in the night and stuff. So that's it. No more milk for her. And she doesn't really have milk throughout the day. Will that have an effect on the calcium in the teeth, the bones? I feel like she gets a lot of stuff from everything else she eats.
You're talking about formulated milk, right?
No, cow's milk.
Cow's milk. Okay. Isn't enough data to give a good answer on that. Not from an evidence point of view. Everyone passes down the idea that cow's milk is going to make teeth strong because of the calcium content.
Yeah. But there's lots of calcium.
Calcium is not just existing in cow's milk, just like you say. There are other means of it. So as long as you're aware of that, I don't think it's a problem.
Spinach. Yeah. It's in broccoli. Not in the highest doses, but it's still there. And she gets a varied diet. So I'm thinking, there's no way that little girl's deficient in anything. I look at her and she's like a tank. So to be honest.
The thing I would just be aware of as a mother is the development of adult teeth occurs typically between 0 up to about 2 years old. And that's the majority of the adult teeth that you show when you smile.
Okay.
That's when the diet is relatively important in terms of calcium. When some people get white spots or black spots or yellow spots on their teeth at an adult age, it sometimes can be due to developmental or dietary issues at that time in their life. And by the time they're at that age, no one remembers what was going on at that age.
Exactly.
So, but your daughter's in that time right now. So,
well, she has yogurts.
But it sounds like you're right on top of it. So.
Yeah, she has Greek yogurt because I'm like, well, her microbiome needs a bit of work, and she has kefir. So I'm thinking, well, there must be calcium in that, and so she's not having that bottle at night time anymore. So that's that. So, but I do give her a dummy because she does need that comfort to go to sleep.
Regular dummy. Just a normal one?
It's, well, I did my research and I bought an orthodontic one.
Okay.
It's,
Do you know if I can tell you based on the shape of it?
Okay.
But if it's an orthodontic one, it probably is okay.
I'll show you, actually. I will get it up for everybody. So for
Let's
mothers who are listening to this, it's called Bibs. Let's just have a look on Amazon. And then there's another company who I bought from before, I can't remember. Bibs Dummies. And you tell me. Okay, so it depends. That's 6 to 18 months. So that's the size that she's got at the moment. And it's quite long. And then it's got the little ball on it. If you can see that on my Amazon page. There's also one called Nook that I gave her when she was very, very little. And that had like a tiny thing on it. And then I can't even describe the Nook ones. Again, I always read the I don't know if it's just marketing though. Do you know what I mean? It says orthodontic, orthodontist led.
Yeah, I'm not sure this one is orthodontic led. However, I've got no issues with it.
Okay.
I think it's going to be fine.
Okay. Because obviously I want her to have beautiful teeth. I was a thumb sucker for ages, and I've had loads of dentists. Yeah, I've had so many braces.
So you might already know this, but the palate, the hard palate and the soft palate is forming based on how the tongue sits against it, the pressure the tongue puts when breastfeeding or with a dummy. All that time is encouraging the bone development. So if the pressure is put in the wrong place, it can encourage teeth to develop in the wrong place,
right?
Which thumb sucking can cause an issue. Using something like that, I think it'll be fine.
Okay, because she kicks off when I take it off her.
Yeah, I bet.
And I'm like, no, she's not having it. And she's nearly 18 months now. She's like a month away. So I was like, at 18 months, she's not having it anymore. But
nothing wrong with it. No, it's good.
Okay.
Yeah, I mean, and the substitute is actually you take it off them and they put their thumb in the mouth.
Exactly.
Which is way worse.
Way worse,
Because
yeah.
what ends up happening is it's not flexible where the lips and the teeth are. So they end up pushing the teeth.
So I had
forward.
like teeth that's almost
And
like
you
went
were
like an
different.
arrow. Then
Yeah.
I had a gap.
Yeah.
And my the roof of my mouth is so high. I also sucked it so much that like my thumb is still a lot smaller today.
No way.
Yeah. Like
So you're the example of
exactly.
of that,
And
right?
I've had a lot of orthodontics.
Yeah.
A lot. And I've paid, I can't even imagine how much I've spent on dentistry.
It's interesting, even with the thumb sucking being addressed and having one of those regular dummies, people are still having a lot of orthodontic treatment in America and the UK, whereas 100 years ago we didn't have that.
Isn't that because, and you'll know this, isn't it to do with our face shapes are changing?
We don't know why it's happening.
Right.
People are theorizing. Our face shapes are changing. They're getting shorter kind of front to back this way. And as a result, there's less space for the teeth.
Okay.
You may have heard that wisdom
Yeah.
teeth are equivalent to an appendage. We're not going to have them in a few generations' time.
Well, mine haven't even dropped.
Have you got them?
I've definitely got
Definitely
one
got them,
because it's half come through.
Okay.
And, I was just like, well, just leave it.
Lacking space.
Yeah.
And as time goes on, we'll lack even more space. And then you expect teeth to just come through with just not enough space. They're crowded. Braces are required. So the other thing is diets as well. We used to have a much more fibrous diet. We used to use our molars much more, hence the wisdom tooth. Our diet these days is much softer. It's processed foods that are very soft. We're being encouraged to eat things that are extremely soft, more than that we would naturally have. So all of that is encouraging our development to go off the beaten track.
Yeah. So, I mean, what could we use to, I feel like my jaw never gets a workout really, What would we eat to kind of like get that going?
A big problem in the modern world is snacking on stuff, eating when we don't need to eat, because we can, it's available. And all the snacks, like you say, even for adults, are heavily processed and they're usually quite soft. A good one, which may or may not be popular with people, is nuts.
Yeah.
They're really beneficial for teeth in that they are alkalinic, meaning opposite of acidic.
Yeah.
So they will neutralize anything you've had early that day. And they're quite tough to chew as well. So it helps your ligaments on the teeth, helps the teeth come together normally, and it's going to be a good thing.
Yeah. High fat content though. I mean, I know people who go, oh, you said nuts are great, and they would eat an entire packet of like almonds when actually in reality.
You should have a small handful,
Yeah, you'd never be able to get hold of that many almonds in real life. When I was on that beach, I found beach almonds and I found 5 of them, and it took me 20 minutes to open one of them because actually a beach almond looks like that, but when I opened it up, it was like that.
And there's a reason why, is that nature is telling you this is something that is quite precious, high calorie,
high reward.
Yeah, same with macadamia nuts. They're the most dense foods, and people just buy a huge jar. And
exactly. And now, with processing and factories, whatever, that high effort has been taken out of the high reward. Yeah, so you don't work for it anymore. But
have to be aware of that then, be very aware. And if you don't want to eat anything then and just have a workout with your jaw, you can use something like chewing gum.
There's another question. Chewing gum, demonized, or are you a big fan of it?
I'm a moderate fan of it. And I say moderate deliberately because one has to consider how much they're chewing gum. It's fine as long as you're not going overboard. And how much is overboard is very subjective. It depends on your dental situation and how high risk you are. Okay. If your teeth are orthodontically straight like yourself, stable, you've got a retainer, your teeth are not coming together in an adverse way, having chewing gum is okay once a day. Mm-hmm. It will help those ligaments, like we said. If it's a sugar-containing chewing gum, needless to say,
Hubba Bubba or something like that.
I wouldn't go with it.
Yeah.
No. Thankfully, most of them are sugar-free these days.
Yeah.
And there is a small environmental piece on them as well, because they cause a lot of litter.
They do.
They're quite an awful task for the council to clean up off the pavement.
And
so I'm a little bit concerned of that, especially in London.
They disregard it. Yeah. I know I've disregarded it, and most of the time I try and put it in the bin, but there has been times where you just lob it out the window.
And what goes into it is relatively synthetic.
Yeah.
So even if you put it into the bin, I feel like it's almost like a plastic that's going to go into landfill and not going to go anywhere.
You're not wrong. I actually use something called mastic gum. Have you ever come across this?
No.
Okay, so this is specifically to build your jaw.
Okay.
So it's really hard. So it's like tree sap, basically. You can get it on Amazon, but it's it's in the completely...
It's biodegradable.
Completely natural product. You chew on that. It doesn't really taste really nice unless you're going to put in some mint to it, but it's literally just a natural product. It's so hard. Your jaw will be aching after about 2 minutes.
Wow.
But it's to build up this jaw muscle. Anyway, and then you keep it. So I used to keep a ball of this stuff. Sounds gross, but it was only me eating it. Yeah. And then it goes harder and harder and harder. So it gets hard to chew. Yeah. But I used to just chew on that all the time.
You're suffering from weak jaw muscles?
I shouldn't be. I definitely shouldn't be. Not after that.
No. Well, one thing I'm noticing is people are not suffering from weak jaw muscles. It's quite the opposite. Because life is stressful these days, it tends to manifest as grinding our teeth.
Yeah.
So nighttime, we're using our teeth much more than we should. Tend to have bigger jaw muscles. If anything, we should relax them.
Right.
And there are different dental appliances we can design for that. But
there's Botox. I see a lot of girls put Botox in there.
Being another, kind of a medical approach to it. So the mastic one, I would say, use sparingly as well.
I really, because I want that look like I've had filler in my jaw, even though I haven't. I don't want to put filler in my jaw, but I want to have that nice line. I'm actually trying to actively build that up.
I hear you on the jawline on aesthetics. My only concern is that your bite force is going to increase.
Right.
So if your bite force increases, composite bonding could be at risk. Teeth wear down faster. When we assess our patients, we assess their bite force. People who are at high bite force are in a category which we have to be careful on.
Okay.
And
why is it a bad thing to have a high bite force?
Any dental work that goes into the mouth is at higher risk of breakage.
Okay.
Natural teeth, higher risk of tooth wear. Okay. You can generally expect teeth not to last as long.
Okay.
Our teeth are only designed to last 40, 45 years.
Well, I'm due another lot of composite bonding. It's been 10, 12 years now since I had it done.
Well, they've done well.
They've done really well.
Very well. I mean, we observe 5 years with composites.
Oh, really?
Yeah. Because not everyone is as diligent as you are with looking after yourself, researching things, going to see a dentist. Most of the time, people get their cosmetic work done and they don't really return for maintenance or repolishing. If people did that, I think they would get the longevity you're experiencing, but life gets busy.
Well, it cost me an absolute bomb in the beginning.
Yeah.
And so I went back for a consultation. He's like, you know what, I'll give you the same price as I did in 2000, whenever it was. I was like, oh, great, nice one. So I'm just going to get them replaced. But I potentially might need a root canal. I've had a little bit of sensitivity. I've actually already had a root canal in my front tooth because I hit my tooth once. So then I'm looking at something the other day and my friend was like, oh, I'm not getting a root canal. It's so bad for you. And I meant to actually properly send you this YouTube video. I'm totally not making sense here, guys. But basically, I'm watching this guy. He looks like a bit of a charlatan to me, but he is linking root canal surgery with like heart attack.
Yes, cancer.
Yeah, cancer. You name it. It's all to do with root canals.
I think I've seen the video and seen the documentary on it as well.
Okay.
Yeah, root canal being the cause of many illnesses.
Okay. Is that true or not? But I'm like, well, what was the option? I can't not have the root canal if I'm actually in agony.
Option is to remove the tooth.
Well,
which is quite extreme. It's quite extreme. It's a front tooth.
It's my front tooth.
And that comes to the answer that I have, which is the potential for the root canal being a negative for medical health going to outweigh the benefits of actually keeping the tooth, which is what we're trying to do here? The answer is I don't have the data to tell you that the root canal is not causing medical issues. Other than that, we've been using root canal treatments for decades and we're not really seeing it anecdotally. No one's done the study though. And I'm not sure the people in the videos and the documentary have done any studies.
No.
Not ones that are
I'm pretty sure this guy was a chiropractor.
Potentially. Yeah.
I was like, why are you even commenting on this, mate?
However, it is complex how the mouth interacts with the rest of the body. To give you a picture of what root canal treatment is, inside of each tooth, there's a nerve supply. Sometimes the nerve supply needs to be removed. You remove the nerve, disinfect the part within the tooth, and you fill that area in with a rubber material, a very plastic version of rubber. And that's the concerning part. You're leaving something synthetic inside the tooth, sealing it off so that no one can ever see it and touch it again. And the other aspect is people are saying, well, you're leaving a living part of the tooth that's died in the body. You should remove the tooth. But there are big downsides of removing teeth. It's a front tooth.
I know. There's no way.
Replacing a tooth is difficult. It can be done, but...
Yeah, but then to get it to match the other tooth,
it's really hard.
It's like almost impossible.
It's tough. Yeah, it's tough to do.
I would have to then get rid of like my first front teeth.
You would.
To make so that was not an option. Plus I was absolutely in agony. I was like, just whatever you can do.
So I think we just have to take the new reported ill health of all the modern interventions we've got with a pinch of salt and just ask ourselves, are the healthcare professionals really trying to hoodwink us and tell us what we need is not for our best interests? Or should we just keep an open mind and listen to everything, but perhaps consider what the healthcare professional has to say, because it's usually founded on an evidence base, especially in the UK and the US. That's my opinion on it.
Okay.
I try and listen to everyone, but it needs to hold a good amount of truth in its biological mechanism firstly, and that mechanism then needs to be supported by an evidence base. I appreciate you can't always get an evidence base for everything because of medical ethical approval these days, but we should avoid making sweeping statements and removing or disregarding a very well-established technique.
Yeah.
Not to say I'm trying, because there's a confirmation bias there. We've done it like that always, so we should do it like this for the future. That's not necessarily what I'm saying. I'm saying that we have observed good health outcomes from root canal treated teeth across millions. It's not a small evidence base. So let's
carry on with the root canals.
I think so, for now anyway.
Yeah. Okay, fabulous. Well, I'm going to have to wrap it up here, Sahil, unfortunately. And I think we've pretty much got through all our myth-busting questions.
Yeah, I'm sure you have more to come.
Yeah, I've really enjoyed chatting to you today. It's been great. So if any of our listeners want to get hold of you or have a look at what you do, where can we find you?
Yes, sure. I am based in Marylebone in central London. It's in the medical district, and it's a clinic concentrating on cosmetic and reconstructive dentistry. We generally handle all the aspects we've discussed today, except root canal. We actually work with a specialist in that area for those things. And we're generally seeing people for cosmetic, aesthetic work, also people who've got tooth decay and issues like that. So it's been great to talk to you.
Brilliant. And if they want to follow you, what is your name on Instagram?
Instagram, it's Dr. Sahil Patel, and TikTok, it's Dr. Sahil as well.
Fab. I'm sure we'll list it all in the show notes. But thank you very much. And it's been a pleasure.
Thanks so much.